Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the General Medical Clinic.
Nice to meet you.
Are you are you Mrs. Samina Yassin,
Yes,
38
Doctor, I
year
am.
old? Nice to meet you, ma'am.
Nice to meet you, Doctor.
Well, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, Doctor.
During my conversation, I will write some notes. It will be confidential. Is that okay with you?
Okay, Doctor.
So I got from the letter from GB that you complain of weakness. Can I know what do you mean by term weakness?
Okay, Doctor. For the last couple of months, I noticed that I am not so much active. Actually, I cannot do so work like before. I work for a grocery shop, and at that shop, I cannot do like before. That is, I am not active. I do not get so much energy that I could get before. So I thought that initially it would be my due to my work stress or due to my sleep problem, but it is increasing day by day, and it has become difficult for me to sometimes continue my job. So I am afraid for that why I am having this. It is something serious or not. And after that, I visited my GP. He did some blood test. Said that a normal blood test is fine, and he thought that I should need proper evaluation, so he sent me here.
I'm sorry for your suffering. I'll try to help you out in this regard. Miss Samina, can I know what do you mean by weakness? Is it tiredness or you feel no power in your muscle?
Yes, doctor, I feel that I am not so much energetic. I do not get much energy.
And is this the first time or you have the same condition before?
No, this is the first time.
And does it started suddenly or gradually?
Gradually.
And is it progressing
Yes,
progressing
doctor,
by
it is
time?
it is progressing and increasing.
And is there any specific part of your body or general?
No, it is present all over the body, doctor.
No part more than part, like your hand
No, it is
more
it is
than.
it is generally present all over the body, doctor, in all parts.
Mhm. And is it the same all day or there is a specific time in the day?
Present all the day.
All the day. So when you wake up at morning, the same like at the end of the day.
Yes, doctor.
And do you notice anything make it worse? Like
Nothing special. Something just like I do not get mass energy, but so that I cannot do my works. But I haven't noticed anything that brings it somewhat to would say and it. I haven't noticed anything like that.
like exertion and the causing more tiredness and weakness or
No, not like
no
that.
effect? And anything make it better,
No,
like rest.
no.
And Miss Samina, do you notice anything else in during this period, like stiffness at the morning, for example?
No,
Any joint pain?
no,
Anybody told you that you look pale more than before?
no,
Any yellowish discoloration of your eye and your skin?
no,
And do you notice any increase in body temperature?
no,
Any sweating at night?
no.
Any lump or bump any in the body?
Yes, doctor. I noticed some lump on my neck.
Where? In your neck?
Yes, doctor.
And when did you notice?
Maybe for last few months, maybe for last 2 months.
And is it increasing by size?
Yes, doctor.
And is it tender?
No,
And is it affecting your breathing?
no,
Is it affecting your swallowing?
no,
Do you snore at night?
no,
Does it affect your voice?
No.
or speech?
No.
And uh, any change in your eye?
No.
Uh, and do you have any weather preferences?
Truly speaking, doctor, I like more warm weather because sometimes even I have to wear some warm clothes. Where my any other family members, like my husband, doesn't need anything, but I need that warm clothes to keep my warm, to keep my to feel better.
Any hand checking?
No.
Any racing or pacing of your heart?
No.
Do you feel like your heart beating more slow?
No.
Any change in your skin like dryness?
Yes, doctor. That is another problem that I think that my skin is becoming drier than before, and I have to use frequent moisturizing cream.
Any skin rash otherwise?
No.
Any skin rash when you exposed to sun?
No.
And any change in your hair,
No.
like fall in your hair or it become more thick or more dry?
I think I am losing some hair, and I don't know if it is something abnormal or not.
And any change in your body weight?
Yes, doctor. I think I lost a few kg weight over this period.
You lost weight?
Yes,
And how's your appetite?
I think appetite is somewhat less than normal. I cannot eat so much like before.
And the decreasing in the weight during how long duration?
Maybe for last 3 or 4 months.
And is it intentional or unintentional?
No, doctor, I had no intention to lose weight.
And can I ask you a personal question, like any change in your period, monthly period?
Yes, doctor. I am losing less blood, and even it comes after 3 or 4 months and persists for only few days, like 2 or 3 days.
And how was the amount?
Blood is very little amount of blood. Even sometimes I have to pay change only one per day.
Can I know if you take any OCB like pills?
Yes, doctor, that I'm taking for a long time.
And can I know if you have previous pregnancy?
Yes, doctor, I have to side
When the last one?
6 years ago.
Any complicated
No.
delivery or pregnancy? And can I know if you have any other condition of note like diabetes or hypertension or anything?
Doctor, about 3 years ago, I needed a gland surgery on my neck.
When was that?
3 years ago.
3 years ago. And can you mention the reason why there was?
They
What is the
said
reason
that
for?
there were some cancer in my neck gland.
I'm sorry to hear that. And how do you do after the operation?
I was fine after that. They said that it didn't go anywhere.
And what was the operation? Is it total removal of your gland or partial only?
Partial only.
Mm. And the doctor said, how do you do after that? Is it cure or you need follow up?
He said I need follow up.
And how is the follow up? Do you receive any chemotherapy or radiation?
No, doctor, I felt better. I just went to the doctor for once. I felt better. I didn't seek any medical attention, or I didn't go follow up. Actually, I was so busy, I couldn't actually make the follow up. I'm sorry for that.
Mm.
10 minutes
Uh,
have
and
passed.
uh, otherwise, do you have any bone pain?
No,
Do you have any cough or anything?
no.
And do you have any family history of note, like cancer?
Yes, doctor. My mother had also cancer in her neck gland.
And I'm sorry about that. Can I know if you have any hard stool?
I think I am little bit constipated nowadays, doctor.
And do you have do you go frequently to bath water?
No,
And do you have any headache?
no,
Any change in your conscious level or any dizziness or anything?
no,
And do you have any fits?
no.
How is your mood, Miss Samina?
I feel low mood, doctor, nowadays.
Any specific reason for that?
No, I haven't found anything.
Otherwise, you have any tummy pain?
No,
Can I know your medication, Miss Samina?
I'm taking some birth control pill. Otherwise, I do not take anything.
Do you have any allergy?
No,
Do you have any history? Did it mention before or family history?
no.
Uh, what do you do for living, Miss Samina?
I work for a grocery shop.
And does it affecting your job and daily living?
Yes, doctor.
I'm sorry about that. I can help you by referring to occupational and social services. Is that okay with you?
Okay, doctor.
Thank you. Uh, Ms. Simania, can I examine you?
Okay, doctor.
So I will start by general look. If there is, how is the nutrition status, any cachexia.
No,
I'll check. I'll check for paler jaundice.
she's mildly anemic, not eccric.
I'll check if there is any tremor, any tachycardia.
No.
The pulse. I'll check the neck if there is any swelling of the neck.
Yes, swelling present on the left side of the neck.
I'll check if it is tender, not tender.
Not tender.
Is it symmetrical both sides?
No, only on left side.
Is there? I will ask a patient to take a sip of water and ask her to swallow and see if it is moving with the swallowing.
It does not move.
I'll check from behind with another. It doesn't move.
No,
I'll check from behind with another sip of water to check any node and check in detail the gland, the mass. I mean,
okay.
I'll check for lymph node in the neck and
Yes,
in the underarm.
yes,
There
palpable
is
through
lymph
lymph
node.
nodes.
Uh, uh, I'll check abdomen if there is any mass.
No,
Check the lung if there is any decreased sound or pleural effusion or any
no,
other sound. I'll check the leg if there is any edema or rash.
no,
Can I ask you, Ms. Samina, if you have ever complained of low blood sugar?
no,
Uh, any history of high blood pressure?
no,
I will look for Ms. Samina if any habitus, cochinoid habitus.
start.
So we continue the examination. I will look for any cochinoid appearance.
No,
Okay, Miss Samina, what is your concern?
Why I am having this, doctor? Is it something
Um,
serious?
Miss Samina, it's I got from your history and examination that you had suffering of long history of tumor in your gland, and I'm sorry to tell, but this most likely it is a, relapse of your tumor in your neck. On top of that, I want to rule out a condition called mean one. It is a combination of multiple gland problem, and it is familial that run in the family. Maybe your mother had it also. For that, I will refer you to the group of specialists who will admit you and uh, uh, do multiple blood tests and imaging. And I will meet you again with the result to tell you the final diagnosis. Is that okay with you?
Okay, doctor. That means you are saying that my previous tumor in my neck that has come back again.
There is good chance that there is.
Okay, doctor. Will I die, or is it a curable condition?
I'm sorry, but it is a very difficult question to be answered, but it is possibility because it is a serious condition. We need to do for you full investigation to tell you what is the possible treatment, but I cannot assure you if it is curable as it show advanced stage as there is lymph node and recurrence of the tumor.
Doctor, that's very
Any other
disappointing.
concern, Ms. Samina?
That is very disappointing for me, doctor. Can you give me something, some medication that so that I can give get energy, like some vitamin tablets?
For that, Ms. Samina, we need to find out the reason for your tiredness and to treat the cause for the tiredness. After we find out the final diagnosis, we'll give you all the treatment that it help you with your energy. And I will be referring you to the nutritionist and the consultant and for oncologist, for the surgeon to find the best treatment for you.
Okay, doctor.
Any other concern you have, Ms. Samia?
No, doctor. You have explained everything well. Okay. So, have you reached any diagnosis?
It is most likely that the patient has the recurrence of the old tumor in her thyroid gland, and there is possibility that she has a condition called mean 2P or most likely MEN 2P, but I couldn't find the triage. I found evidence of hypercalcemia, which is hyperparathyroidism, and the thyroid cancer, but I couldn't find that third.
Do you have any other alternative diagnosis in your mind?
It could be any any mass of the neck.
Can you give me any alternative diagnosis?
Mass of the neck could be other than thyroid, like um, thymoma,
Okay.
or could be cancer of the thorax.
Anything else will you suspect for this lady's weakness, generalized weakness?
Could be myasthenia gravis, but it doesn't show the feature of gradual weakness at the end of the day because of thymoma.
Okay, and do you think it can be a presentation of hypothyroidism also?
Against of that, there is decreased weight and decreased appetite and lymph node in the neck and the mass that doesn't move with the swelling.
Okay, so it can be a possibility. Okay, and do you think that lymphoma can be a presentation?
What is this? Sorry,
Lymphoma.
lymphoma. Sure, yeah. Lymphoma. Sure.
Do you think that anemia can be a presentation?
Yeah, anemia. Yes.
Okay, and any chronic infection like tuberculosis.
Yes.
Okay, so how will you
But
investigate that?
investigation will include, aside from the basic investigation, patient will need thyroid scan, CT scan for neck and chest and abdomen and pelvis. She will need lymph node biopsy and analysis. Uh, she will need calcium level, TFT, and calcitonin level, and glucose level, and
Okay, TFT level means you means thyroid function test, right?
thyroid function test,
Okay,
and BTH.
okay. So suppose this is a case of multiple endocrine neoplasia. How will you manage her?
How?
Will you manage her?
How I will manage it? So she will be under multidisciplinary team approach. She will be followed by gland doctor and the endocrinologist and the surgeon for the review of thyroid cancer, and she she will have investigation and treatment for the underlying hyperparathyroidism and possible insulinoma or pheochromocytoma or pancreatic, other pancreatic gland, other gland manifestation.
Okay, and do you think that involvement of the geneticist would be necessary for this lady?
So, what is the specialty?
Genetic disease specialist?
Genetic, yeah, sure. She need genetic
And
counseling
involvement of the
and
occupational
genetic.
health therapist, physiotherapist.
Yeah, that's why she need a multidisciplinary approach, including all specialty.
Okay, fine, thank you. So I want to highlight on some points that you said if it is tender or not. Actually, tenderness is a medical term. Okay, you can say
Even
that
tenderness,
does it show or do you feel pain when you touch this?
tenderness, it's jargon. Consider jargon.
Yeah,
Tender, is it tender? If I said, is it tender? Is it jargon?
yeah, tender is a jargon.
Mm.
You can say soreness or you can say does it feel pain when you touch?
Mm.
Okay. And another thing that in this explanation you said about the relapse. Relapse is also a medical term.
Perhaps. I should say recurrence.
No, you should say that it has come back again. Okay.
Mm.
And also in the personal history taking, you haven't asked about the smoking history, alcohol history, driving is not important here. So that can be omitted. And any recent travel history. Okay.
Mm.
Do you get me?
Yes, sure.
Okay. And also in the past history you have asked that, and that was very fine. And in the examination you haven't mentioned any that you want to check for the neck scar, what type of scar.
Scar, yes.
You should have
Yes.
at least look for that.
Yes.
You haven't see the gait also for thyroid examination. You should seen the gait. The patient said that she cannot do her work properly. So if there is any involvement of the proximal myopathy, you should have seen that. Okay.
And, do you advise during the exam to write notes for the examination or not to use the paper at all?
Okay.
Because, for example, now I forgot too many points. If I write the highlight in the paper, I will not miss.
Okay. I will suggest that you first practice lots that will give you the more confidence, because this is not so hard or so much difficult. And in the exam, always try to make some notes that you want to going to follow this pro forma. So just make it pro forma and go with that, so that you will not miss anything.
Mhm.
Just make short notes because you will not get so much time.
Yes.